So we have my notes, which I did have a chance to review today. You'll be relieved to hear. We have a warm environment in which to work. We have a matter table, kneeling surface. We have some extra kneeling padding as we want it. We have the full-length foam roller. And, oh, sorry guys. And we have light hand weights for later, possibly. We still might not get to them in today's class. So you can always opt to do this without the weights. It's hard enough. Robert, no weights. And now, get that roller out of the way so Gus does not get impaled. Official welcome and begin. So we'll start standing on the tennis ball. I forgot the tennis ball. Annette, have you been trying this on your own? Is it fun? Good old stomp and smush. Step and roll. Massage the sole of the foot with the tennis ball. We used to do this every class. And then we got away from doing it because I frankly got sick of doing it because it takes some time. So we're doing kind of a free-for-all version today. You step and roll, applying as much pressure as feels right for you. It's great for the standing leg because it helps you stay stable. And then you'll stop rolling, place the tennis ball just behind the ball of the foot, and then allow the toe joints to drape over without crossing the toes, keeping the toes long and open. And then you'll arc your foot from side to side over the ball. So we're massaging latitudinally. This is the Tropic of Cancer. Before we were on the prime meridian, and now we're Tropic of Cancer. And trying to mobilize the ankle joint. The knee is bent, the heel is on the floor. Then we bring the ball directly underneath the ball of the foot. There's that little groove between the two pads on the foot. Spread the toes wide like a fan, reach out, over the ball, wrap, lift, and pull. So this is what we call a prehensile foot. Oh good, here's Deborah. Spread, reach, wrap, lift, and pull. You keep going with that. I'll let Deborah join us. Spread, reach, wrap, lift, and pull. Spread, reach, wrap, lift, and pull. And let's do the other side. Massaging the sole of the foot. Kneading. 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 Hurts so good. Do it in a way where it doesn't hurt, but that it does feel so good. Exploring all the planes of the bottom of the foot. The inner arch, the middle of the arch, the outer arch. Yes, and the ball does try and get away. As you imagine, if it takes a pummeling like this, it might object on occasion. You know, it'll get used to it. It's fine. And then bring the tennis ball just behind the ball of the foot. Heel will be on the floor. Knee is soft. We're working on mobilizing the ankle joint and all the metatarsal bones, the long bones in the midfoot, draping the foot around the ball and arcing from side to side. Tropic of Cancer. Up and over. And Deborah is back. Roll side to side, arcing side to side. Side to side, side to side. And then bringing the tennis ball directly underneath the ball of the foot. Make sure that your leg is aligned somewhat. Spread the toes wide like a fan, reach them out, wrap them, lift, and pull. As I was saying before, prehensile foot, like a little birdie on a branch. Spread, reach, wrap, lift, and pull. I had a really old ball where I could actually lift it up. That's because all the flocking was fluffy. Spread, reach, wrap, lift, and pull. So I was cheating. But hey, when your tennis ball gets fluffy, you could try it too. Spread, reach, wrap, lift, pull. One more time. Doming the foot. Spread, reach, wrap, lift, and pull. Okay. Let's take that tennis ball to a little bit of wall space. It's okay. Yes, breathe. Keep breathing, people. We're going to do a little peck massage. And what you're going to do, to show you close, collarbone, tennis ball. You're going to get yourself to a wall space or a door, and you're going to massage the ball across the chest to the front of the shoulder and explore this kind of fan shape area at the upper part of the chest here, underneath the collarbone. And then you'll do the same thing on the other side. So fling yourself to the wall. Turn your head one side or the other. Probably the most bang for your buck is to look away from the ball. And then you're going to massage a fan-shaped swath of muscle from the breastbone, the sternum, out to the armpit, and then a little sub-armpit. Polly's ball is mutinying. You can have your arm down by your side. You can have it, yeah, if you put it down, Deborah, you can just let your arm dangle, yeah. Then you can kind of really get in those folds a bit without being overstretched. Ugh. Yes, Kimry, good choice. Then you do the other side. If that pressure's too much, you can just hold it and massage it with the other arm. If that's, if it's too tender, particularly, Kimry, if after I got my vaccination, all of my lymph was so angry that the thought of doing this at that point was just out of the question. Okay. Ball set aside. All done with the ball today. Hi, Gus. Welcome to my mat. So now that we have massaged up here, our feet are awake and alive, spread your toes wide, lifting them up off of the floor. Legs are parallel, so the weight is on the heels, and you feel that you have pressure on the big toe joint, but also that you have some pressure on the pinky toe joint. And the knees are soft, meaning we're not trying to push the kneecaps back in space, but you have a sense of aligning your bones vertically, one on top of the other. Then lay your toes down so that they're flat on the floor. Yes, I'm just going to move you over there so they can see my feet. Okay. So shift your weight forward and shift your weight back. Shifting forward and back. Just checking in with the body. Exhaling to go forward. Inhaling through the nose. And one more time. Exhaling and inhaling. Come center, shifting side to side. Exhaling for one full set. Exhale to each side. And then inhaling through the nose. And then exhaling. Good. And inhaling through the nose. And then come center, exhale. Feel yourself lengthening up and down. Great. now we are going to review briefly some of the shoulder cueing that we worked on last week. So first we talked about the connection between the shoulder blade, protraction, retraction, and that action and how it connects through the body. So if you start with reaching your right arm forward. I'm not gonna mirror you today. I'm gonna say what I mean and do what I say for once. So feel that as you reach your arm forward with your palm facing your midline, have a sense of reaching down. So like you're gonna try and scoop your arm underneath something and feel that connection underneath the shoulder blade and along the side of the back, the serratus anterior. You don't have to reach far. It's not $1 million. It's just like 50 cents. You're like, maybe I can't even buy a soda with this anymore, right? And then this comes across, this serratus anterior comes across, and you can follow this with your left hand underneath the breast tissue to the obliques. Then that goes diagonally across to the inner opposite hip. So shoulder blade, serratus, obliques.
Harriet, I can't hear you.
Oh no, you can't?
No, you're just too quiet.
No.
You need your outdoor voice.
Okay. So shoulder blade, obliques across. I'm standing very close to the camera right now, so you should be able to hear me. Diagonally across to the inner part of the hip, and then down to that opposite thigh. So a sense of like a ambassador's sash across the body, and then to the inner thigh. And we'll reach the other arm forward as well. So just start by reaching your left arm forward and back. Feel the shoulder blade here. And then feel a sense of, as you reach forward for 5 to 50 cents. Have a sense of dropping the shoulder blade down as well, and feel that connection underneath your armpit as it goes, and trace with your right hand, side body, across lower ribs and below the ribs, down to the right hip, and then to the inner right thigh. So as we reach forward and back, which we're going to do right now, you want to get a sense and just an imagination of this kind of cross action. So you're going to reach your both arms forward with the palms facing each other, and back, and forward, and back. Inhale, reach forward. Exhaling back. And one more time, inhale, reaching forward, and exhaling back. From there, we're going to take our right arm, and we're going to reach forward, turning the palm to face down, and then pull back and reach back with a rotation, palm up. Reach forward, internal rotation. Yep. Pull back, external rotation. Reach forward, internal rotation. Reach back, external rotation. Ta-da! Give it a thumbs down. And give it a thumbs, I don't know. My thumb disappeared. One more time. Forward and back. Yep, turn and look. Other side, reaching forward, give it a thumbs down, bend the elbow and reach back. Reaching forward, follow your hand with your eyes and reach back. Palm up, thumbs down. Stay close to your body so that you're folding at the elbow. You're bringing your elbow close to you and your hand is coming close to you. So it takes less effort in the outside of the arm to execute that. Yeah. One more time, forward and back. Inhaling, reaching forward, and exhaling, reaching back. The next idea that we're going to review is more of that serratus work and how, I'm going to come close to you. So bend your arm, palm is facing you, 90-degree angle. Bring the left hand to the front, the bottom of the elbow, and you're going to gently reach your elbow into your hand, like that same scooping, that kind of down and forward a little bit, versus just reaching forward. That scooping down and forward helps to keep you from kind of going all the way. From there, bring your hand to the inside of the elbow and meet the resistance of your hand. And then keep that resistance and straighten and bend. Actually, turn the palm to face away here, because this is more like a push-up, right? Straighten and bend, with keeping those muscles of the shoulder active. Exhale to straighten. Inhale to bend. Easiest push-ups of your life. Exhale to straighten and inhale to bend. Shake that out. Let's change sides. So, palm facing you. Elbow bent. Elbow slightly underneath the shoulder. Feel the arm rooting in the socket to start. Bring the right hand to the elbow. Left elbow. Good. Reach the elbow into the hand. And you're going to feel that sense of scooping that down and forward slightly. And feel a connection right underneath the armpit there. From there, maintain that pressure. Bring the right hand to the inside of that elbow. Push the elbow away, but meet the pressure of your arm. Turn your palm to face away and straighten and bend. Exhale to straighten. Inhale to bend. And you don't have to straighten all the way. Good. So the pec is working to stabilize the front of the shoulder last time. Good. Shake that out. So now, as we revisit our scapular glides with some leg additions, Poink. Staggered stance. This is an add-on from last week. So, like you're taking a step forward, the hips are level and even. You're going to reach your arms out in front of you. And you're going to start to bend as you reach forward with both arms. You're going to pull the shoulder blades back as you straighten. Inhale, reach forward, bend. Exhale to straighten. Inhale, reach forward and bend. Exhale to straighten. So remember, we have that inner thigh connection. Inhale, reach forward and bend. Exhale to straighten. 2 more times. Inhale to bend, reach forward. Exhale to straighten. 1 more time. Inhale, reach forward and bend. Exhale, straighten. Change legs. Same situation here. More scapular glides, endless. Feel the collarbones wide and open. Bend as you reach forward. Straighten and stand. Good. Inhale to reach forward. Feel the shoulder blades spread wide apart. Exhale to stand up. Inhale to bend. Yep. And instead of going forward and backwards, we're not lunging forward and then standing backwards. We're going straight up and down, like you put your back up against the pole. Yeah, there you go. Good. 1 more time. Forward and back. Good. Nice, people. Roll out the shoulders, shake the arms. We will come horizontal roller. Kimmery, towel is also a good option. I'm going to show the towel iteration of this. This is a lying down exercise. So you lay your towel flat. For anyone who has neck issues or does not feel good clasping their hands behind their neck, we're going to put the roller horizontal across the rib cage, but this is iteration number 2. Roll onto your side, lie on your towel, and you make a little hammock for yourself with the towel so that you can do some curl-ups here, just small ones, if this works for you. The other option too, I don't like it as much, but just towel wide. And you can hold wide like this, Kimmery, so that you have a sling behind your head and the towel's behind your shoulders. Can you see that? So it's not just behind your head, it's behind your head and your shoulders. And so your arms can be wider and down. For the rest of us who want to use the roller today, version with the roller is as follows. Roller behind the bottom of the shoulder blades, hands behind the neck at the base of the skull. We're working on arching back with the elbows towards each other. And this is when we circle our elbows. We widen the elbows to a point where the tops of the shoulders can still stay relaxed. We push the bottom ribs into the roller and we levitate the upper chest and the upper ribs in line with the lower ribs when the elbows are still wide. We bring the elbows together. So you're not rounding forward, very important difference. You're just in a plank. Elbows come together, reach the elbows up and back. Inhaling, widen the elbows, feel the shoulder blades spreading wide. Push the bottom ribs into the roller. Use these upper abdominals to help you come up into your incline. Elbows are wide. 5 more like this. Elbows together, up and back. Inhaling. Widen the elbows just to a comfort point. Use the upper abdominals and the leverage of the roller to curl up. Elbows together, up and back. Inhaling. Widen the elbows, tops of the shoulders relaxed. Exhale, curl to your incline. 3 more. Elbows together, up, back. Widen, exhale, curl. So it's an action of sitting up without an upper back rounding. Good. Elbows together, up, back. Widen, exhale, come up. Good. Last time, elbows in, up, back. Widen, and up. Roll over onto your side. While we are here, we're going to stay lying on our sides. Kimberly, roller acceptable for this one if you want to do it. This is a lat massage, armpit massage with the roller. It's Polly's favorite. So you're using your bottom leg and your top leg to help you apply pressure to the side of the back, the side of the armpit, the front of the armpit a little bit. And by armpit, I actually mean below the armpit. So not in the pit itself, but most of the tissues around and below. Oy, 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 oy. Is it better than last week, people? For those of you who are here. Annette, is this feeling better than last time? Worse or the same? Better? Worse? The same. The same. Okay. Pam, I missed yours. Where you're like, worse! Oh, it's the same. Okay. Do it every day. There was a point I was doing it every day. It really does get better. Polly, we were doing this a lot too. Then from here, bring your hands behind your head at the base of the skull. And bend the knees, stack the hips up, stack the feet up, stack the knees up. Everything's all stacked up. The elbows are wide enough, but the tops of the shoulders are still relaxed. You're going to rotate your body to face the floor, and the top elbow will fold in. Feel the shoulder blades spreading. The breast tissue on the bottom side is being smushed slightly. Widen yourself back into your side lying position. Spin the bottom elbow up to the ceiling and arc back over the roller. Come back to your side lying position. Rotating towards the floor. Top elbow, instead of, keep the top elbow reaching away from the roller as you rotate towards the floor. Come to your side lying. Bottom elbow spins to the side and tries to spin up to the ceiling. So I'm rotating away from my pelvis. Come side. 2 more times. Rotating towards the floor, exhaling. Coming to side lying, inhale. Exhaling, rotating towards the ceiling. Squeeze those inner thighs together. And up. Last time, rotating towards the floor. And center. And to the ceiling. And center. Great. From here, this is when I added this fun little thing. So bring the top if possible, you're pushing into your bottom elbow. So we've relieved some of the pressure into the armpit, but that's proportional. So Pam, let me know if that doesn't feel true for you. Then if that's not true, you could come up onto your elbow. So the elbow is wide and you're a little bit, there's some relief of pressure from the roller, but also some support from the roller. From here, top leg turns out, comes forward, and place the foot flat on the floor. Bottom leg straightens, it sneaks behind, and the leg is in line with the rest of the torso. From here, Robert, you know where we're going with this, right? You do. We're going to do a little adductor work, inner thigh work for the bottom leg. Push down with the top foot. Feel like you're hovering the waistline off of the floor, and then you're going to try and lift the bottom leg up. It won't go very far. And come down. Up and down. So this is that oblique connection across here, inner hip, inner thigh, but we're trying to drive that connection from the inner thigh. 2 more times. 1 more time. Maybe we should do 2 more, I think. I'm just starting to get a sense of feeling through this kind of waistline up here. Great. Bend the knees. Collapse into the fetal position. We'll do the other side. Holly, are you doing okay with this? Everything? No. I can tell you that you're not enjoying this. That's not my intent to torture you. Do we need to unmute yourself and ask questions? Totally fine. While we massage on this side. Massaging the lat, which is this back little giblet, right? When you feel that you're pulling your armpit down while squeezing this little giblet behind your back, you feel something happening. That's your lat muscle. We're getting that. They love to work. You're using both legs. The bottom leg is pushing down and the top foot is pushing down to help you roll. If the neck is getting tired, you can hold the neck with the top hand to give it some love and support. So I'm really I'm squeezing my neck like a mama cat, squeezing by the scruff of my neck. Massaging a little bit on the front, so the side of the pec muscle. And going as far down as you feel is necessary for you at this moment. From here, stop rolling. The roller's underneath the armpit. You're on the side of the body. The hips are stacked up, the knees are stacked up, the feet are stacked up. Heels are in line with the sit bones. Hands are behind the head, supporting the base of the skull. So I'm giving a little cupping action to the bottom of my skull. I'm rotating towards the floor, reaching the top elbow away from the roller. Coming to the side. Bottom elbow spins forward and lift the chest up. Try and arch back over the roller. And come up. I'm showing you the biggest version I've got. Your version doesn't have to be that big. Rotating towards the floor. This one probably feels pretty natural, kind of nice, except for the squishing of the breast tissue. And then the bottom elbow reaching to the side and trying to lift up to the ceiling and trying to hoist yourself up and over the roller in the back. I feel a big stretch through my top elbow, through that pec and center, and spin towards the ceiling, arching back, basking in the sun. Use that image one more time. Kimberly, massaging with the tennis ball in the armpit would be good for this too. And arching back. Okay, here we are in our comfortable sideline position on the roller. So you want to feel support from the roller, but not too much pressure at this point. I'm perfectly comfortable here. You might not be, so get yourself comfortable. Turn out the top leg. Place that foot on the floor in front of the bottom leg. Stretch the bottom leg straight, so sneaking it behind. Take a peek to be sure that the heel is in line with the hip. and the hips are still stacked up, and you're active through this bottom waistline. From here, bottom leg lifts up and down. So we're working that top inner thigh. And down. Up and down. Up and down. Up. Down. Down. Up. And as we keep going with this, at first I only felt inner thigh in a big way. Really reach through the heel, the bottom heel, Robert. But as we keep going, I start to feel this top waistline working. So that's that opposite connection here. Last time. Fun and joy. It only gets better from here. We're going to massage our IT bands now. This is what you were hoping I was going to say. You can stay on this side, or you can change to the other side. You can come up onto your hands. You can come onto your forearms. You're using support from the top leg to manage the pressure on the bottom outside thigh. So my bottom leg is straight. It's a similar position to what we were just doing, but now your inner thigh hopefully is not working, and that you're massaging the outside of the bottom leg that's on the roller. Rolling is a workout into itself. Kimmery, if you have a stick, you can massage your quads, or like any kind of, use the heel of your hand to massage the outside of your thighs, massage your quads. If you have like a dowel or a broom, you can use it like a rolling pin, or just like an iron and kind of iron yourself out. Start to rotate your bottom thigh so that now you're more on your quad. And you can put two quads on at the same time. Yes, Kimmery, good. And then you can turn away from the camera, but we're going to do the other side. So you can do the other IT band. I'm going to turn so I can face you. So I can be a witness to your suffering. I see you. Good, Kimmery. That's very good. Oh, gosh. I don't know about you, but this doesn't get any. This is one that you do it regularly, you can tolerate the pressure better, but it's still painful. I'm sorry. I wish I could tell you that all of a sudden one day you would no longer feel anything here. If you don't feel anything, you can start to bend and straighten the bottom knee. That should help you feel some things. And then be sure that you got enough on this quad to feel satisfied and open. Okay. Now, let's come into a seated figure 4 stretch. A couple options for this. Sitting on the floor or the table. Kimmery, keeping the feet down, crossing one ankle on the floor probably. But this is the other version. Crossing the right ankle over the left thigh, and then walking the bottom foot in and walking yourself to your thigh. So you're basically trying to turn yourself into a little clam, and mostly trying to bring the pelvis and that be sure that the ankles cross. We're not having cocktails here, girl. We're going to keep the knee apart so there's a space between the legs. So the knees are not crossed. The ankle is just across the thigh. So slide your foot back a little bit. Can we see this? Make this a better angle. And then you're trying to bring your pelvis, using your hands, push your pelvis towards your thigh bones. You don't necessarily get closer with your upper body, although that will certainly increase your sensation. We are trying to strengthen our lower back and roll, almost like you're trying to put your pubic bone back down on the floor, and then rock from side to side. Good, Kimmery. This is good. The rocking is just to distract you from the task at hand, from the fact that your arms are starting to get really tired from pushing. Pam's smiling. She's like, yes, they are. Ah. All right, stop rocking. Separate your arms and your legs to create more space for you to unwind yourself and do the other side. So crossing the ankle, or the bottom of the shin, maybe more accurately, over the thigh. Yeah, exactly. Walking the bottom foot towards you. Walking yourself towards your pelvis, towards your legs. And then rocking yourself like a baby, telling yourself, everything's going to be all right. Swaying from side to side. Does everyone feel something here? Yes? Okay. This one, I've been feeling this more than any other version. I teach a lot of different versions of a figure 4 stretch. It's for the external rotators, the glutes, and the haunch tissues. Separate yourself, uncross. Okay. Come onto all fours. Bring your roller. So first, put your roller underneath. This one actually is safe if you want to kneel Kimmery on your table, but you don't have to. So the first action we're doing is feeling our collarbones spread wide apart. The hands are underneath the shoulder. The palms are spread wide. The pointer finger is directed straight ahead. And pressure is into the knuckles of the hand, like you have a sense of suctioning the palm slightly. So you're not clawing the earth, you are slurping it gently with the palm of the hand. The fingers are nice and long. And from here, you're going to hinge yourself back, keeping your spine nice and long, reaching the sit bones back behind, and then hinging forward as far as you can go, which might not be very far because of the limitation in the wrists. Pushing back, exhaling, inhale, reaching forward. Good. Pam, bring your bottom ribs up to the ceiling a little bit, and that straighten your arms more. Push back, good. Come forward, good, Kimmery. Yes, good, Polly. Exhale back. Good. Inhale forward. Good. 2 more times. Exhale back. Inhale forward. Nice. So we're getting hinging action at 2 joints, hip and shoulder. Exhaling back and inhaling forward. From here, we are going to come down onto our forearms. Then you're going to belly flap your thighs onto the roller. There's no graceful way about getting into this. So you're going to crawl yourself forward onto your elbows. So you're on your forearms, your elbows are underneath your shoulders, and the roller's about midway on your thighs. You're going to have a sense of that suction through the palm with the fingers spread wide, a sense of pushing into the hands, a sense of stretching your mat wide apart with your forearms and your hands. And then from there, you're going to push yourself back slightly so that the elbows are a hair in front of the shoulders. The pubic bone is pulling towards the ribs to keep the low back nice and long and the ribs lifted. And you're reaching out through your legs to keep them active. And then we will begin the exercise, which is scapular glides. So keep that sense of pushing, keep that sense of widening. Shoulder blades slide together, the chest drops down towards the floor without losing the connection to the abdominals. And then push down and away, keeping that sense of pushing into the hands and widening through the forearms, collarbones wide. Inhale, dropping down. Exhale, pushing up. So you really feel this in the serratus anterior where we were working earlier. And feel those oblique slings helping you keep your torso supported in this plank position. 2 more times like this, then we're going to add on. Inhale down, exhale up, and 1 more more time. Inhale down and exhale up. From here, if you choose to add on, this variation is slowly peeling the forearms off the mat from the elbows, pushing. Doesn't have to be high, and then coming back down. Keeping the plank position of the torso. We're working our triceps. Slowly straightening from the elbows, peeling them off the floor, and come back down. The key is slow. The key is keeping the ribs, bottom ribs connecting to the hips, the pubic bone pulling up to help keep lengthening the low back. The feet will drop down slightly. Exhale to straighten. Inhale to bend. One more time. Good. So come down, rest, sit your hips back, walk your hands back. So booty in the air, elbows drop down, head drops down, either on the roller or not, just taking a little rest moment. And then I wanted to talk about one little thing and then give you an opportunity to try this again if you wish. So, remember how earlier we did this, and then we turn and we did this? There it is, right there. Now you're doing it two at the same time, right? What happens, and Robert, I observed this with you, in that when you straighten, we start to lose this inner part with the pec, probably because of what you're experiencing. So I think the key part of this, in keeping this pec connection, you're helping that external rotation of the humerus, so this sense of the upper arm bone, as dramatically reenacted by my lower arm as well, okay? But so this upper arm bone is still externally rotating, and that's going to help this connection into the back there. So if, as you straighten, that you find your elbows winging out to the side in order to do the exercise, don't do the exercise. Do struggle with peeling the elbows off of the floor, or go to the wall, right, and start to feel a sense of peeling the elbows off of the wall without letting them wing out to the side. Does that make sense? And to that, I'm seeing Annette because she's right below me in my little box. Can't be too narrow because that's unreasonable. We have to make sure that the collarbone width, to make space for you to exist between your arms. Unmute, Robert, question? Or are you just observing? You're muted, so I can't hear you talking.
You know what helps on that? Especially with the wall, that I find if people have therabands, you do a looped theraband, and that makes the resistance, so it kind of makes you not go out that way.
Right.
So that's what.
Yes, the only problem with that is that then you're training these outer muscles to work into that resistance, and we actually need to do something like squeeze something big between the elbows, really. Like a yoga block, but I think it's too narrow. At any rate, we nerd out. We can nerd out for hours. Polly, I know you're loving this. But if you would like to try the wall version, you can also do it standing. So let's stand at the wall. I think that might be nice. And you can come into a slight incline. The elbows will be just in line with the shoulders if you're on an incline. No roller required. Feel that sense of pulling the pubic bone towards the ribs. Move you slightly this way. Boink, boink. So you can see me more from the side. So you want to be sure we're not in a happy puppy here, that we're wanting to keep our body aligned with a sense of pulling the pubic bone towards the ribs. And then from here, start to push into the hands and peel the elbows off of the wall without widening the elbows. Keep gravity, and it's that sense of the serratus pulling the shoulder blade down and wrapping it forward that helps with that. Kimmery, are you loving this? Widen your hands, Kimmery. Because I think, too, when we have more breast tissue going on, we have to allow for that. That's part of our existence. So you have to be wide enough to allow yourself to exist between your arms. All right, coming back. scheduled programming on the floor. Boop, boop. Oh my gosh, 10 minutes. It only gets better from here. Body float, head float, aka torpedo. We come to lying face down on the table or floor or mat. Have your hand weights nearby if you wish. I have this sequence that I call using the end caps of the weights and you turn the faucet. So it's like the end cap of the weight is a faucet. We turn the knob on, we turn the knob off. We turn the knob on, we turn the knob off. But we're going to keep the weights on the floor as we do this. So, observe once. I think it'll be easier rather than craning your neck. So, holding the weights if you choose to use them at the end cap. The weights are lengthwise in line with the body. Your forehead is hovered on the floor. You let the shoulders roll in, turn the water off. Externally rotate the water knobs. Feel the collarbones widening. Float the head up and reach the legs. Pubic bone pressing into the floor. The weights are still on the floor. Turning them in. Shoulder blades spread wide. Turn the knob on. Float the head. Collarbones wide. Active reaching through the legs, and pubic bone stays connected to the floor. And then come down. Internally rotating the arms so the fronts of the shoulders will drop down towards the floor. Externally rotating the shoulders, the collarbones widen, the shoulder blades slide down the back, the head floats out, and you're looking adoringly at your mat or your table with the pubic bone grounding into the floor. One more time. Inhaling, internally rotating. Exhale, externally rotating and floating the head up. And then let go. Come down, pushing yourself back again through that articulated hinging position of the arms and the elbows. We're done with that. Bueno, Kimry. Then we come to sitting. We work the internal and external rotation component of the shoulders. And we do that in order to mobilize the upper back and the chest. To help us reverse gravity and computer posture. So, the knees are bent, the feet are flat on the floor. There are different layers of this. So, first layer is schlumping. Sitting, schlumping, you're on the back of your pelvis. And internally rotate the hands and turn your shoulders in. Just what we did, but we were like, yes, exactly. From here, externally rotate the shoulders. Feel how as you externally rotate the arms and the shoulders, now the chest wants to start to lift up. Go with that. Externally rotate the fingertips so they're going to point outwards and slightly backwards. And feel like you're stretching your chest wide and open. Right. And then we're going to soften, slump into yourself. You can bend your elbows, turn the hands in. Externally rotate. Collarbones widened. Push and lift the chest forward and up. I'll show you from a different view. Internally rotate. Externally rotate and push and lift up. I'm showing you my biggest range of motion. You can also have your hands wider apart. Internally rotate and externally rotate. Feel that when you externally rotate and you push through the arms that you're not over straightening this way, that you're trying to align the bones to shore up the back. From here, the next layer is reaching the tail towards the knees and and bridging up. Coming down, internally rotating and softening. Externally rotating, reach the tail forward and up. Yep, and swinging the legs back, pelvis back, and coming down, internally rotating. Don't be afraid to slump. Externally rotate. Feel the shoulder blades sliding down the back. Shore up the upper back by pushing with the arms, and then swing the pelvis forward, tail towards the knees. And then coming back down, we'll do one more time. Internally rotate, slumping. Externally rotate, pushing down into the arms, reaching the chest forward and up, and swing the legs up and forward. Have fun, and swinging back and down. Oh. Give yourself a little hug. Discs, oh fun. Oh, Kimmery, used for your discs. This would be a super great iteration for you sitting on the bench or standing, depending on the proportions. We can work that out after. Okay. Now, we get to lie down lengthwise on the roller. Have your hand weights nearby. But we're going to do some leg stuff. Get yourself organized, lengthwise on your roller. Kimmery, not on your roller. You'll lie down. So, hand weights nearby. Align yourself on your surface. Feel the natural curves in the low back, behind the neck. Feel the eye sockets dropping down and the cheekbones heavy and dropping down to the floor. Kimmery, you're going to externally rotate your arms so your palms are facing up. Yeah. So you're going to try and have some openness through the front of the chest here and use gravity to help stretch out the pec muscles. Everyone else, you're going to have either your palms facing down or you're going to have your elbows bent. So the elbow points are the points of contact on the mat, and the palms will be facing each other with the fingertips pointing straight up towards the floor, straight up towards the ceiling, meaning the place up there. Take a deep breath in and exhale. As you keep breathing like this, inhaling through the nose, exhale through the mouth. Feel the bottom of the pelvis coming upwards and the transverse abdominis squeezing inwards three-dimensionally to help you find balance and control on the roller with ease and relaxation through the shoulders and the neck. One more time, breathing in and out. So we're trying to add an active component to this breathing sequence. On your next exhale, you're going to take your right leg off of the floor, keeping very still on the roller, trying to keep from wiggling at all. You're going to exhale, shore up that connection. You're going to inhale, elongate the leg out in front of you as far as you want, and then exhale, pull the leg in. Inhale, stretch forward, and exhale, pull in. Good. Inhale, reach forward. Exhale, pull in. Good. Inhale, forward. And exhale, pull in. Put the foot down. Exhale, other foot up. Inhale, stretch the second leg forward. And exhale, pull in. Inhale, stretch forward. And exhale, pull in. Inhale, stretch forward. And exhale, pull in. Inhale, stretch forward. And exhale, pull in. One more time. Inhale, stretch forward. And exhale, pull in. Place the foot down. Hand weights, if you choose to use them. Grab them. Elbows touching the mat. Weights pointing up to the ceiling. Palms facing your body. Take an inhale. Exhale. Push down into the feet. Push your arms up to the ceiling and voila! Look, Mono, in line with the sit bones as best as possible. Feel the inner thighs working to help you stay stable. Feel that connection to the opposite inner hip inside of the pelvis. So left inner thigh crossing to the right inner hip and right inner thigh to the left inner hip. Slightly different from what we did earlier. Inhale, reach your arms up. More scapular glides. Exhale, slide back down and below the roller. Inhale, reach up. And exhale, slide back down. 2 more times. Inhale, reach up. Exhale, slide down. And 1 more time. Inhale, reach up. And exhale, slide down. Come up to your start position. Turn your palms to face your legs. Bend your elbows wide to the side this time with the elbows slightly down, like you're pulling a bar towards your chest. And exhale, push it up. Inhale, bend and widen. Exhale, push up. Inhale, bend, widen. Feel as you exhale that the exhale is initiating the push of the arms. So the air coming from the bottom of the pelvis, squeezing out by the abdominals, going out through the chest and out through the arms. Inhale, bend, widen. Exhale, stretch up. 2 more times. Inhale, bend. And exhale, stretch. 1 more time. Inhale, bend. Good. And exhale, stretch. Good. Turn your palms to face each other. Bend the elbows close to your body. Set the weights down. Hands down by your sides. Widen the legs and rock from side to side of the roller. And then using care, as well as your arms, your legs, and your feet, come off of the roller and lie flat on your back on the mat for just a moment. So you'll slide off the roller. Yep, lie down on your back. Just feel how nice that feels. Feel how your collarbones are wide and open. Slowly elongate one leg out in front of you, or slightly to the side, and then the other leg. Feeling a sense of the pubic bone pulling up towards the rib cage to help keep from overextending in the low back, but to have a sense of openness in the fronts of the hips. Open your arms slightly to the side, palms up. Feeling lengthened, relaxed. Take a nap. Yeah. Rolling over onto your side. Coming on, folding yourself and just lying there for a second. And then pushing to come up. And this is how I leave you today. We don't get all the way up. Thank you very much.